Penile implant surgery is actually a pretty straightforward procedure. It is designed to help men get their erections back when medications stop working. But even though the surgery is straightforward, it is still a surgery. And like with many other surgeries, we have to make an incision in order for us to place the prosthetic device. Now, you have been doing some research and maybe you have read or heard that there are different approaches, the infrapubic approach and the penoscrotal approach. Trying to figure out which is better? This video is for you. Hello, my name is Dr. Jonathan Clavell. I'm a urologist and penile prosthesis expert in Houston, Texas. Today, I will break down one of the biggest debates among surgeons. Which surgical approach is better, infrapubic or penoscrotal? How many incisions are required? What are the advantages and limitations of each technique? And most importantly, does the approach change anything for your experience, recovery, or your final outcome? Let's dive in. Before explaining each approach, we need to remember that during penile implant surgery, we are inserting a medical device inside a man's penis. A penile prosthesis is not like a prosthetic leg. With penile implants, the word prosthesis does not mean that we are cutting the penis off and adding a different one. This is not a transplant. This is an implant. We are placing something inside a man's penis in order to help him get a firm, rigid erection. And because the inflatable implant has three components, two cylinders inside the penis, a reservoir that goes into the lower abdomen that will help store the saline water while the penis is flaccid, and a pump that is placed inside the scrotum which will help transfer the fluid from the reservoir into the cylinders. Some men think that we need three separate incisions or that there is an external component. That is, that you will need something outside your body in order for the implant to work well. Well, great news. With modern techniques, we can place all three components through one single incision. And that is where the terms infrapubic and penoscrotal come in. They are simply describing where that incision is made. Think of it like entering your house through the front door or the back door. Either way, you're getting inside the same house. These are just two different paths to access the same anatomy so we can place the implant safely and effectively. Let's start with infrapubic. If we break down the word infrapubic, we have infra, which means below, and pubic, that stands for the pubic bone. That is, we are going below the pubic bone. With this approach, we make a small incision below the pubic bone. Through this incision, we are able to get access to the top side of the penis. And given that we are above the penis area and the lower pelvis, we have better access to place the reservoir. In fact, the first surgeons inserting inflatable implants over 50 years ago started placing them using this approach, but with a larger incision. Then came Dr. Paul Pereira's technique in Miami, during which the surgery can be performed with a fairly small transverse incision. Most surgeons who prefer the infrapubic approach use some variation of this technique, a small incision close to the pubic bone through which we can get access to the penis from above. Since we are accessing the penis from above, the surgeon needs to be aware of the anatomy on the dorsal aspect of the penis. As you can see in this picture, the nerves that provide sensation to the penis lie on the dorsal wall or above the penis. With the infrapubic approach, at least theoretically, there is a risk of injury of those nerves. These are the nerves that provide sensation to the penis. When these nerves are damaged or injured, a patient may complain of numbness in the penile shaft and head of the penis. Sometimes, and specifically during revision surgery, those nerves can be difficult to visualize for the inexperienced surgeon. However, no need to panic, because most experienced surgeons who favor the infrapubic incision are able to avoid injuring the nerves without any major risk. And the risk of this happening is extremely rare. Another benefit of the infrapubic approach is speed. In the hands of a skilled surgeon, this approach provides for a slightly quicker surgery than penoscrotal. There was a research study published in 2018 that mentioned that the infrapubic approach allowed for the surgery to be done 22 to 37 minutes faster than a penoscrotal incision. Why? Quicker dissection. On another note, given that the incision is in the lower abdomen, the surgeon also has better access to the lower abdomen, and therefore placement of the reservoir can almost be done under direct vision. How about pump placement with an infrapubic incision? With the infrapubic incision, the surgeon is further away from the scrotum, which can affect placement of the pump. This has its advantages and disadvantages. The advantage of being away from the scrotum is that, generally speaking, there should be minimal manipulation and dissection in the scrotum, and therefore less swelling down there. And with less swelling, there is less pain, and the patient can potentially start cycling their implant earlier. The infrapubic technique generally allows for earlier device activation, but because everything is coming from above, the pump sometimes wants to ride upward after surgery. Therefore, the patient has to pull the pump regularly in order to prevent a high riding pump. Let me explain. The incision is in the lower abdomen, and all the components are being placed from above. This creates a longer path for the pump to get to the lower part of the scrotum. After surgery, the patient needs to regularly be pulling on his pump in order to avoid the pump to migrate and ride upward to where it came from. This could lead to what we call a high riding pump. A high riding pump is not an emergency, but for some guys, it can be a problem because it can limit their ability to be able to penetrate. As you can see in this image right here, if the pump is riding high and located at the base of the penis, this man can feel like his penis is functionally shorter when it truly is not shorter. The problem would be that the pump limits his ability to penetrate with his entire penis. With a high riding pump, he will only be able to penetrate up to here, when ideally he would like to penetrate down to here. A limitation of the infrapubic approach is that if the patient has difficult anatomy, which can include Peyronie's disease, complex revision surgery, and corporal fibrosis or scar tissue, be it for priapism or a history of a prior infection, exposure in these cases can be challenging with an infrapubic approach, which may require the need for a second incision in order to address whatever pathology the penis has. Another limitation of the infrapubic approach is that if the surgeon is not careful of going proximal when performing his corporotomies, the tubing exiting the corporal bodies and into the scrotum can be felt at the base of the penis near the pubic bone. This may be a risk for some men with minimal fat in the prepubic area. That said, most experienced surgeons who favor infrapubic approach are very good at hiding that tubing to provide for the best functional and cosmetic result. Now let's talk about the Penoscrotal approach. As the word itself says it, we are making the incision at the junction between the penis and the scrotum, hence Penoscrotal. The Penoscrotal approach can be performed in different ways. The incision can be done transverse, it can be done vertically, it can be done on the side of the scrotum. It can even be done along with a scrotoplasty, also known as a ventrophalloplasty incision, which removes excess skin between the penis and the scrotum and can give the appearance of a longer penis. One major advantage of the penoscrotal incision is that we are far away from the nerves that give sensation to the penis. The main structure that we need to be mindful of during the penoscrotal incision is the urethra. But the urethra is easy to see or feel, and we can easily avoid injuring it during dissection as long as there is no difficult anatomy. The penoscrotal incision also allows for better visualization of the penis anatomy. Why? The skin in the scrotum is very flexible and what we call forgiving. What we mean by flexible is that it can stretch fairly well, which gives us exposure to the corporal bodies and the penile shaft. There is no doubt that this incision provides for better exposure of the corporal bodies than the infrapubic incision. And what we mean by forgiving is that the scars in the scrotum tend to heal very well and are rarely noticeable after a few months. I personally prefer to make my incision vertically to that natural ventral line that we all have in the midline of the penis and the scrotum. This way, the incision ends up being invisible. Similar to the infrapubic incision, in the hands of an experienced surgeon, an implant can be placed fairly quickly via the penoscrotal incision. Most surgeons are able to finish the surgery within 30 minutes to an hour. I have personally witnessed surgeons be just as quick and efficient with the penoscrotal approach and finish the surgery within 20 to 30 minutes. Now, when it comes to reservoir placement, the penoscrotal incision is further away from the abdomen. Therefore, the reservoir is sometimes placed more blindly. That said, most experienced surgeons who understand the anatomical structures in the abdomen are able to place the reservoir safely from this incision without injuring any structures and without needing a second incision. With good retraction, and if the anatomy allows for it, we can still have very similar access to the lower abdomen with the penoscrotal approach. How about pump placement with the penoscrotal approach? The penoscrotal incision requires more dissection in the scrotum in order for us to have access to the corporal bodies. Just like other approaches, this has its advantages and disadvantages. The big advantage that we have with the penoscrotal incision is that since we are already in the scrotum, we get to choose exactly where the pump sits. For some patients, it is better to place the pump in front of the testicles. For others, behind the testicles. Personally, I prefer placing the pump in the posterior aspect of the scrotum, that is behind the testicles, which allows to hide it better when being with a partner. And because the pump is placed from the scrotum into the scrotum, most patients do not have to pull the pump down after surgery to prevent it from high riding. A high riding pump can still happen, but it is less common with the penoscrotal incision. If you're concerned about the placement and wonder if you need to pull on it, just contact your surgeon and I'm sure he or she can help guide you and give you a proper answer for your specific situation. The disadvantage of dissecting in the scrotum is that it can sometimes produce more swelling in the area, and therefore some patients sometimes have to wait a little longer to start their activation. As mentioned before, a big benefit of the penoscrotal approach is that we have excellent exposure to the proximal corpus, and if we ever encounter complex anatomy like Peyronie's disease or corporal fibrosis, we can always extend the incision to have better exposure to the penile shaft and be able to provide for optimal placement of the penile prosthesis while keeping a cosmetic result. There is also research suggesting that high-volume surgeons using the penoscrotal approach achieve longer prosthesis length, specifically between 1.5 to 2 centimeters longer when compared with the infrapubic approach. However, in that same study, satisfaction and quality of life outcomes were equivalent. Similar to the infrapubic approach, if the surgeon is not careful, tubing can accumulate at the base of the penis with the penoscrotal incision. However, instead of having the accumulation of tubing at the top side, with the penoscrotal approach, the redundant tubing can be palpated below the penis. But there are ways for us to prevent this from happening. In summary, both the infrapubic and penoscrotal approaches offer excellent outcomes for penile implant surgery, and neither technique has been shown to provide superior satisfaction, quality of life, or lower infection rates over the other. Each approach simply has its own set of advantages and limitations. The infrapubic incision can allow for slightly better access to reservoir placement, quicker surgery, and less scrotal swelling, while the penoscrotal incision provides outstanding exposure for complex anatomy, a relatively invisible incision, and more precise pump placement. In the hands of an experienced surgeon, both can be done safely and fairly quickly. At the end of the day, a man can achieve an equally functional, rigid, and natural feeling erection through either method. What truly matters is allowing your surgeon to choose the approach that best fits your individual anatomy, and most importantly, the approach that that surgeon performs most comfortably and confidently. These are just two different paths toward the same destination, restoring your sexual function and helping you and your partner enjoy intimacy and the satisfying, confident quality of life.